This is the demo video for the Medicare Supplement and Medicare Advantage quoting tools available through the Berson-Sokol online quoting tool. In order to start, we'll start by clicking Run Quote underneath Medicare Supplement. And then we have a few different options. We can select a client from the client dropdown and it will pre-populate that client's information. Or we can go ahead and enter their information here and just run a quick quote without creating or selecting a client. Or if we want to create a new client, we'll just type in their name. So maybe we do test client, I'll call it test client 3, and then we can create a new client. So we have a few different options, either selecting the drop down to select a client, or we can create a new client, or we don't have to select anything here, we can just do a quick quote. So we'll enter our zip code, age, gender, tobacco status, how we'd like to sort the results by, and the plan type, as well as the effective date and household discount if we'd like to apply that or not, and then we'll hit get quote. We'll notice that our results are sorted by price as we indicated on this first page. Our top plan we see here is Continental Life Insurance Company of Brentwood, Tennessee. We see the premium, the carrier name, household discount, policy fee, parent company, AM Best rating, rate type, plan type, S&P rating, rating class, years in market, and effective date. We, on the left-hand side of our screen, have a few different options. We can export this full list of all these carriers by clicking the print, PDF, or Excel export buttons. We can also click to expand or contract our quotes. We can choose to apply our discounts, which will apply the household discount if there is one available. We can see what the annual rate is. We can select market analytics to remove or add those, and we get 3 pieces of information with market analytics: age increases, increase history, and market data. Age increases shows for the next 4 years what the person currently pays on this plan, so it gives you a bit of a predictive analysis based on the current rates for this age. The increase history shows the past increases or decreases that this plan has taken, and the market data shows us on a national and state level the number of lives covered, the premium amount, loss ratio, and market percentage, and we can scroll between years to see how this information has changed year over year. We can also choose whether select plans are included in these results, and if we have a select plan, it would have a blue icon that says select next to this, so we would know it was a select plan. On the left-hand side of our screen, we also have an About Quote button we can click, and this will give us definitions of those age increases, increase history, covered lives, market percentage, premium amount, and loss ratio, as well as the source of this information. So if we ever forget what any of these market analytics pieces of data mean, we can always reference this About Quote. We can also do a compare quote, so if we don't want to export the entire list of quote results, we can select up to 5 carriers at once. I'll select 3 for this example, and you can see they populate under compare quotes on the left-hand side. If I click compare quotes, it's going to show me a side-by-side comparison of the 3 plans I selected. So we have all 3 of our plans listed here, and we can see the details about each of these plans, and we can do a PDF or print of this compare quote screen. I'm going to hit the back arrow to go back to our full results of Medicare supplement plans, and I want to point out that if you click this X next to any of these compare quotes, it will remove them from this compare quotes option. So we can select 3 new plans up to 5 at once. If we ever want to make a quick change to any of these plans, we can change the age or anything else and click Get Quote without having to go all the way back to the very beginning screen. So anything you adjust, we'll go ahead and show you those updated results. Just make sure you hit that Get Quote button again. I'll take us back to the dashboard and we'll move into the Medicare Advantage quoting tool. We'll notice that we have 2 Medicare Advantage tools. We have this one listed here, and then we have another Medicare Advantage or PDP quoting tool with a green icon. The Medicare Advantage without the green icon is the original Medicare Advantage tool that you may be familiar with. This just shows us the available plans in a given area. Again, we can select a client from the drop-down as I showed for MedSup. That's the same functionality across all tools, or we can enter our information to run a brand new quote. For this original Medicare Advantage or PDP quoting tool without the green icon, this is our basic Medicare Advantage quoting tool, and we have all of our different quote options. We can view plan details, visit carrier resources. We can link to any of these carriers' information here. We can see the max out of pocket, the plan, any of this other additional information, including the plan ID. We can expand or contract our quotes, see the annual rate or the market analytics. And for market analytics on Medicare Advantage, we get the county penetration and company enrollment. We can export these options as we did for MedSup. We can also do the compare quotes as we did for Medicare Supplement. So all of those features are the same. Again, we'll just click compare quotes to do a side-by-side comparison, but this is just to get an idea of what plans are out there. This is the original Medicare Advantage quoting tool, so if you're familiar with this tool, it is a tool that is still available. I'll show you now how we have built a new Medicare Advantage or PDP tool. We'll go back to the dashboard, and we're going to show you the version with this V2 beta green icon listed here. So we'll click run quote, and this is the tool that actually allows you to add in a person's prescription drugs or pharmacies, or both. So we can either select a client from the drop down. We'll want to make sure if we want to save this information for a client that we do select a client or create a client from the drop down, because that's how we save their drug and pharmacy information. So if I do select a client from the drop down that I've already added in drugs or pharmacies for, it will pull in their drug or pharmacy information. So again, let's create a new test client. We'll call it test client 4, create a new test client. Again, I'm just calling it test client for today's example. We'll enter our zip code, all of this plain information. We'll select show prescription drugs yes, and we can choose if we want retail pharmacy, mail order pharmacy, or both. And then we'll add in their drugs. So you can start typing the name of a drug and it will pull up the drugs. We'll select our drug, we'll select our dosage. We can choose our packaging, if there's different packaging, select our quantity and frequency. And then if we want to keep this open and add more drugs, we'd select this check mark. We'll click add drugs. And then for preferred pharmacies, it pulls in Google Maps and it uses the zip code we entered to do a search radius of 10 miles. We can change this to 20 or 50 miles if we'd like. And then we can select our pharmacies to see what the different price points will be for these drugs at these pharmacies. We'll select add pharmacies and then we'll hit get quote. We'll notice when this loads up here that we have our drug listed at the top as well as our pharmacies. We see our plans listed here. We can click show details to see some details about this plan. And then we can see, if we scroll down, we have the company enrollment and the county enrollment listed here. We can also see that this plan has health and drug coverage. One of our 1 drugs that we entered is covered and 3 of 3 pharmacies are in network. If we actually click on the carrier name, we can go into the drug overview, the plan overview, the benefits and costs of this plan, the prescription drug coverage and costs. This is the most important page for most people. It shows us the tier that our drug is in. It shows what the coverage is initially in the gap coverage or catastrophic coverage for each of these drug tiers. And then it shows the client's drug cost per selected pharmacy. So we have Hy-Vee, Walmart, and Walgreens. It shows us the costs, retail costs, then the cost before deductible, after deductible, in the coverage gap, and after the gap for each of these pharmacies. And then as we scroll down, the estimated drug cost per month per pharmacy. We can see these are all very, very, very close for each of these. And it shows what the monthly cost is based on what part of the coverage they're in. And we can scroll down to see each month as we go through each of the months. The carrier resources button shows us how we'd contact the carrier, and it also links to the carrier's websites. You can also print or save this page, or if you would like to compare side by side multiple plans at once, make sure they are plans with the same drug and health coverage. So you'd want to pick plans that have the same health and drug coverage, or just drug coverage or just health coverage. Just make sure it's the same coverage type before comparing them. Then we'll click this green check mark. And we'll notice our plans populate here at the top, and then we can click compare quotes, and then we can see the plans side by side. So we can compare the drug coverage side by side for all 3 of these plans. Again, we can print or save this at the top. I'll take us back to our quote results page, and then I'll take us back to the dashboard. We've now covered the Medicare Supplement and Medicare Advantage quoting tools available through the Berson-Sokol online quoting software. Thank you so much for watching, and have a great rest of your day.